Thank you so much for giving this opportunity. And I'll be showing you two of the cannulas which are modified by me, and they are manufactured by Epsilon. I don't have any financial interest in the product, is that only my name goes with this. So this is the first, this is a TARC viscoelastic cannula. So how it's different from other cannulas is that it's made of 25 gauge, and it has a smooth curve and a tapering end, as you can see here. So the advantage is that it goes easily through our side port incisions, 1.2 mm incisions, and it has a smooth curve, so we get a wider and deeper reach in the capsular bag. And this is the second cannula, which is hydrodissection and hydrostitch cannula. So let's see in videos. So this is on this side is the normal viscoelastic cannula, which is difficult to insert through side port, and you can see you can't go beyond this area, beyond capsular access margin, because of this curve here. But because of the smooth curve of this modified viscoelastic cannula, you can reach deeper. So if I go from side port, I can easily reach because of the smooth curve of this cannula. So it's ergonomically designed that whenever we need in situations like this is hydrodissection and hydrostitch cannula. It's bent 1 millimeter at the tip. It has 85 degree of angle here. So you go on one side and do hydrodissection and turn it around and do. You can easily do sub-incisional hydrodissection also, which is very useful in softer cataracts where it's very difficult to do hydrodissection. And at the same time, you can bend it downwards and rotate the nucleus. In softer cataract, you can also do hydrodelineation with this cannula. This is a softer cataract. You'll see I'm just turned the bevel down and I'm doing hydrodelineation with this cannula, and this endonucleus pops out. So here some epinuclear sheet is there. So you can see that I can easily reach to deeper level, and epinucleus shell, it comes out. So it has a smooth curve which makes it very easily accessible, entire capsular bag. If you have a zonular dialysis, you need to go deeper to push the equator back. It's very easy. So this epinuclear sheet prolapses out with this cannula. You have situations like anterior capsule tear and all those post-polar cataract where you don't want anterior chamber to collapse. So it's very easy to insert through side port incision. Again, epinuclear sheet is there. I go from side port, go deeper down and do visco expression. If you need to maintain chamber, it's very easy to insert through side port, where with the normal cannula you need to struggle. And this hydrodissection cannula is also hydrostitch cannula in the end. You can easily hydrate all the walls of the incision just by rotation of the tip of this cannula. And it's especially useful for topical phaco, which we do most of the time, where cases have where palpebral opening is not that much and patient is rolling eyes upward. So it's very easy to hydrate all the walls of the incision with this cannula. So this is how it's used. Look here. So this is a normal hydrostitch cannula which we use. But once we try to hydrate this wall, it's very difficult to angle the cannula, especially in topical cases. But with this cannula, you can just insert it in the incision, just turn it right, left. You can hydrate all the walls of the incision very easily. Look at this case, eyes is rolling upward, but you just need little exposure to do hydrodissection. So I've been using these cannulas for last 1.5 years now, and they are very useful, and they make surgery very simple. So So I think with this, I'll end my presentation. Thank you so much.
Thank you, Harshul. Very nice presentation. And I think, what is the gauge of this cannula?
So this hydrodissection cannula is 27 gauge.
27, okay.
Whereas the visco cannula is 25 gauge.
25?
And it's tapered at the end. And it has a layer lock mechanism. So it's always important that you, just on syringe, you just screw it with the layer lock because of the smaller gauge as compared to the normal cannula, little more force is required. But within 15-20 days, you get used to that force. It is very useful.
I was wondering that since most of us do make side ports which are at least 23 gauge, so I mean the visco could be even like 23. Have you tried 23 gauge, which would also allow easier, kind of this thing, and yet go from a
yeah,
smaller
I've tried that also, but our incisions are 1.2 millimeters, and this goes very smoothly
Very nice.
through that. Yeah.
Thank you.
Thank you, Harshul.